Effect of polarized light in the healing process of pressure ulcers. Department of Nursing, TEI Athens, Greece. A trial was conducted to examine the effect of polarized light on pressure ulcers of first, second and third grades. Patients with 2 pressure ulcers, one of which received the polarized light therapy, experimental ulcer, and the other acting as control, were included in the study. The experimental ulcers received treatments for 2 weeks consisting of 5 minutes therapy session each day excluding weekends, for 10 days. Experimental and control ulcers were assessed as they appeared on admission and reassessed at the end of each week. 55 patients aged 37 to 85 years and 11.9 years were studied. Pressure ulcers of first, second and third grades receiving extra treatment with polarized light had increased values of epithelial tissue between the first and second assessments of 0 to 30.9%, and between the second and third assessments of 30.9 to 21.7%. Values of the control pressure ulcers were, respectively, from 0 to 5.5%, and from 5.5% to 3.1%. The mean pink/white color values of the experimental ulcers, between the first and second measurements increased significantly compared with the control ulcers, and also increased significantly between the second and third measurements. The mean values of no and minimal exudate of the experimental ulcers increased significantly between first and second measurements compared with the control ulcers, and similarly, significantly between the second and third measurements. Mean surface areas of the experimental ulcers decreased significantly between the first and second measurements, and between the first and third measurements. Pressure ulcers subjected to extra treatment with polarized light in the early stages, first to third measurements showed improvement in the healing process than the control ulcers. Conclusion. This trial demonstrated the effectiveness of polarized light therapy in healing first, second, and third grade pressure ulcers. When polarized light treatment was added to conventional ulcer therapy, rapid changes in appearance and size with complete healing in half of the cases and accelerated partial healing in the remaining cases appeared within 1 to 2 weeks.